A new report from the Centers for Medicare and Medicaid Services details a chaotic scene at Galesburg Cottage Hospital. Investigators claim conditions at Cottage Hospital pose an immediate risk of serious injury or death. In 2 weeks, the hospital is being cut off from federal payment, and in response to the findings, Cottage Hospital sent a statement to News 8 saying Cottage does not agree with these findings as stated and is currently exploring all options to work with regulators and attorneys to remove and/or appeal the decision. News 8's Shelby Kluver has more on those claims in this News 8 update.
After over a month of investigating, the Centers for Medicare and Medicaid Services say the situation inside Galesburg Cottage Hospital is alarming. 4 surveys conducted by CMS from November 19th until December 23rd detail a disorganized, chaotic scene. In June, a patient was unable to receive sustained CPR due to a lack of staff. That same patient eventually died. Then in July, another patient was admitted for COVID-19. As the individual got sicker, staff tried to bring in a crash cart, only to find no resuscitation bags on the cart. And CMS investigators would discover more issues with the carts. In November, it was found that 8 out of 30 twice-a-day crash cart checks had not been performed, and 4 out of 15 daily cleanings of the carts and defibrillators had been missed. This came as the hospital's staff was rapidly dwindling. From March 1st, 2021 to November 17th, CMS found 128 employees had been terminated. Consequently, the ICU had to be shut down in July after all its nurses were pulled over to the emergency room to fill staffing gaps. By mid-November, half of the nurses in both the emergency departments and medical surgical units had either been fired or quit. CMS interviewed one Cottage employee who said, "We have a decreased volume of patients because we have no staff. We are capped at 6 patients right now. They are just cutting all of our resources." They also alleged there were no hospital directors left, leaving managers to fill in while also performing their own jobs and helping out on the floor. In fact, CMS found Cottage lacked a chief operating officer and directors for the emergency department, surgical services, nutrition services, materials management, accounting, information technology, imaging, health information management, case management, and an exercise physiologist. There are also details of nurses being pulled from orientation or made to work without proper documentation of their training and required certifications, all because the hospital was so short-staffed. CMS details interviews with employees who allege the new owner and CEO, Dr. Sanjay Sharma, implemented a new electronic health record system. Staff say that system was unable to properly store records, leading to lost data and improper billing. Then, staff say the owners fired all the coders who could have helped fix the problem. Shelby Kluver, News 8.
Medicare and Medicaid payments will stop at Galesburg Cottage Hospital January 14th. Patients admitted before that can continue receiving payments until mid-February.